So next one is about how to grow smartly. So smart grow, smart build, smart quality, smart build, and smart branding. Now we talk about how whatever business you have, whatever practice, how you can expand, how you can grow. So smart grow, how to plan for a sustained growth. Sustainability is important. For that we have Mr. Rakesh Singh. He is the co-founder. Let me put his here. Just a moment, so that I can do it justice. Yes, so Rakesh is a BTech, Bachelor of Technology from Indian Institute of Technology, Delhi, precisely IIT Delhi, and MBA from XLRI Jamshedpur, a deadly combination, IIT and MBA. And then Rakesh is a co-founder and director with CII, Continuous Innovation and Improvement in Quality Healthcare Catalyst Private Limited, a business delivery organization, partner with entrepreneurs in healthcare delivery industry to manage their ventures and transform them into innovative and differentiated healthcare institutions. CIIQ stands for Continuing Innovation and Improvement in Quality Healthcare. He has more than 3 decades, more than my age, right, of corporate experience with leadership roles across many industries. He has worked extensively in consumer, retail, IT, telecom, and healthcare industries with some of the best names like Godrej, GE, Whirlpool, Pepsi, Tata Teleservice, Idea, Reliance, Jio, to name a few. Okay. So he has done a lot. I think you have heard me what I said. And I think it's better that he tells what he's going to talk to. I request Mr. Singh, come over, take the floor from me, and illuminate us.
Good afternoon. Good afternoon. So thank you, Mr. Rana, for a very generous intro. And I have a very short, small presentation, because I think what I'm going to talk about is already been spoken over last 2 days, especially what Mr. Rana had a great session on quality, Ilya's marketing brand, Sheshadri on finance. I think before that, so many sessions, product, innovation, technology. I think everything has been spoken about. So just to give you a brief, what is a person who's done all his life career in telecom, retail, consumer company doing in this session here. So my entry into healthcare was, I think, more by accident. In the sense, I was working in telecom in different cities. I was in Delhi, I was in Chennai. I've been living in Bangalore for last 2 decades, family especially. So I was keen to relocate to Bangalore. And Tata's, they were launching their telecom operations in Bangalore. So I came into Bangalore. And then I again went out of Bangalore for some other assignment. And I was keen to come back to Bangalore. And Manipal was looking for a non-healthcare professional. So, those days, Dr. Ranjan Pai was very keen to have someone who was their chief operating officer and who had zero understanding of how healthcare is run. So that's how I got into healthcare. I started liking it. Over last few years in healthcare, I realized there are a lot of smaller hospitals in all over India, especially in South, especially in tier 2, tier 3 towns, who are not very good in managing their overall business. So I, along with my ex-chairman of Manipal Healthcare, Swaminathan, we started this small initiative in healthcare management. So we work with the healthcare owner entrepreneurs in seeing how we can work with their on their vision. So I think whatever everyone has spoken about in last 2 days, you need someone in an institution, in a hospital. In this case, it could be an owner, it could be a CEO, it could be any leadership, who has to understand what need to be figured out. You can't do all interventions at the same time. Ilya spoke about so much on marketing and brand. What to pick, what to do, on quality, Mr. Rana spoke about so many things in so many buckets. Which bucket to pick? What is relevant for your company? Similarly for technology, product, innovation. So I think you need to have someone in this system who understands the entire journey for the organization over next 3 to 5 years. And then he plugs and pulls what needs to be done so that company gets into a growth mode. Yep. So how to plan for a sustained growth? What is sustained growth? Sustained growth, by definition, has to be a viable growth. So any business, I think more so for healthcare, a growth can happen only if it is a economically viable business model. So I think it's extremely important to understand, and a lot of healthcare owners, they feel they have to only focus on clinical delivery. They don't focus on viable operations. I think this is something which I think all of us need to be always very careful of. And it is not wrong, it is not bad to be profitable and viable in a healthcare situation. This is I think another very important learning for all of us, that we have to be profitable. Even Tatas are a sort of a not-for-profit company or a group, but I think even Tatas, they have to be viable for them to do whatever they are doing. Very simple mantra, because I didn't want to get into too much of detailing on how growth has to be done, what kind of a business model, what kind of a budgeting you can do. I think all that is for detailing, which can be done at a later stage if someone is interested to understand. For us, the mantra of growth is enhance GDP. What does GDP stand for? G stands for growth as an outcome. A healthcare company, the way we speak about clinical outcomes, the way we speak about so many other outcomes for a healthcare institution, hospital, the institution has to learn to speak and think about growth as an outcome. Growth is not an incidental subject. It has to be thought on a daily basis, and that's how the growth will happen. Second, and the most important thing is differentiation. You can grow only if you are differentiated. I think someone, Shishadri spoke about, there are so many hospitals where same kind of services are being offered by different competitors in the same geography. That is not a differentiation. Differentiation can happen in so many ways, and I think it's important for us, all of us, to think about differentiation, because that's what is important for a viable growth. And the most important, that's why if you look at this circle, the biggest is people. I think we've been talking about people over the last 2 days, but I think in healthcare, focus on people has to be far higher than I think what we normally hear. There is a focus on clinical resources. There is a focus on doctors, but I think non-clinical, non-doctor, administrative focus on people, I think, is extremely important, because at the end of the day, people is what will make the organization run. So GDP, growth focus, differentiation focus, and people focus, I think, are the 3 extremely important mantra for a sustainable growth for any healthcare smart company, smart hospital. And some of these slides are too busy. I will not spend too much of time on them, but these are also, in a way, they also answer why companies or why hospitals don't grow and what hospitals can do to grow. Look at Indian healthcare. The biggest dichotomy of Indian healthcare is we don't have enough beds, we don't have enough people, and at the same time, India has enough technological interventions in every aspect of life. But not more than 60% of occupancy in most of the hospitals, especially smaller hospitals. People are underpaid. If you have a geography where there is shortage of doctors and nurses and other staff, why should nurses get underpaid? I'm just raising this point because I think it's important for all of us to because some answers for some of the bad performance can be in some of these queries. Technology is not used by most of the smaller hospitals. Why? So occupancy is low, though India needs more beds. The salaries are low, they get underpaid, though India has shortage of nurses and doctors, and technology is not well. And again, there are different reasons for root cause for existing dichotomy, but I won't get into this. But just to, as a bullet point, healthcare delivery in India continues to be severely supply constrained, while the large, well-funded, expensive private hospitals chains, mostly in tier 1 cities, get positioned as the only solution to deliver high standards of medical care. So this is where the smaller smart hospitals have to position themselves to become as good as large hospitals in large towns, well-funded. I think we have to find ways of how to make smaller setups also as effective and as good. Again, very busy slide, but the answer for some of the growth issues can be very easily found here. Right from pre-operative stage to market entry to growth and maturity, in every walk of an institution's journey, if it is not well managed, then we get into a situation where we'll have an unviable healthcare institution. And the reverse of that is, if we can take care of each of these 4 buckets, we'll have a viable, growth-oriented healthcare ecosystem. Just to give you an example on, say, market entry. When you enter a new market, a healthcare hospital has to know what kind of a marketing initiatives he has to take so that the impact is powerful. Same way, at a preemptive stage, pre-operative stage, a hospital should know whether they have enough funding, do they need funding. They can't start operations and then start looking for funds later. So many hospitals look for funds when they are halfway through. I think that's not the way it should be. So I think it's important for people to realize that now smaller hospitals in smaller towns is akin to running a large business, and the doctor owners or whoever is managing it has to be well prepared before they start this initiative. I think those days are gone, maybe a couple of decades back, when you can just start any initiative and it will be a successful initiative. Not anymore now. You have to be extremely careful before you invest money and before you buy equipment, because the entire plan has to be well stitched. And we talk about small as I think any large institution. If you go and talk to people in Infosys, they will say Infosys maybe is a large company, but the smaller business units, which comprise of 100, 200 people, are the ones which make it effective and well run. So a small hospital, smart hospital, 100, 200 bed hospitals are the most effective way of running a optimum medical care system. So we have to keep it very, very simple. Just to give you an example, growth, it can be patient centricity. I think all this has been spoken about. Clinical excellence. We didn't speak much about clinical excellence today, but ethical practices. We didn't discuss about ethical practices, but I think this is extremely important for a viable growth in a good healthcare system. We can't not have an ethical system. easiest to engage with. You have to have a healthcare system which is very easy to work with. As Mr. Rana also spoke about, from a quality point of view, it is not only patients. I think patient is still easier to manage, but patient's family, patient's friend, patient's driver. So, these are the people who finally go out and give you story about how you are doing or not doing. Patient, when he gets into operation theatre, he just wants to come out alive. Once he comes out alive, he is very happy. But the family is the one which gives all the positive or negative input about how well that place is doing. It's extremely important to maintain a complete ecosystem experience from a patient point of view. Then differentiation is extremely important. How every touch point is important. It can be through technology, it can be through any one-on-one kind of an experience. Then people anyway is important. Safe, secure, and harmonious workplace, transparent work environment. Some of these things we don't talk too often in hospitals, but these things are as important as the way now we talk about marketing, the way we talk about brand. Same way we should start talking about people importance in hospitals. There's no way you can run a good, smart, small hospital if you don't have engaged and motivated manpower. Just to give on the same on people, if you have disengaged team or a poor leadership, you have a bad hire, disengaged employees, each of these things may look small at the start, but they lead to very high cost for the individual institution. So we have to be very careful about ensuring we have engaged team, we have good leadership, we are very careful about people we are hiring, and we try and keep an engaged employee base. That's important for keeping our cost very, very low. So just to again re-emphasize on people, to reach the top as a smart hospital, build smart teams. Similarly, technology, I think so much was spoken about technology over the last 2 days. Now, what should you use? You can't do everything in technology at the same time. But as a leadership team, you should be very careful on what all needs to be done, how we start with which areas of technology, and if you don't have a prompt and accurate billing system, there's no point doing telemedicine. First get the basic technology in, then you look at everything and anything. So I think it's extremely important for the leadership of the hospital to know what is happening, to know where the gaps are, and then focus on relevant technology differentiations. So it's important for the team in the hospital to know which part of the journey they are in and how they can make it, each of these technology interventions, much more impactful. Same way, I think this point came up in some other presentations also. Conversations are important, not communication as per se. It's important that we ensure that there is a positive conversation which happens all the time about the entire hospital space. And just to summarize, from patron centricity has to be the starting point for an hospital. Profitable growth is the end point, and all the interventions in between. It is patient experience, clinical excellence, delivery excellence, capacity utilization, and collaboration are the intermediate interventions which will take us from patron centricity to profitable growth. And each of these areas are extremely detailed areas. I think a lot of it has been spoken about. But as the leadership team of the hospital, we have to be very careful that which all areas at what point in time we have to focus on to ensure that we are always growing and we are in a viable, profitable growth all the time. So this is what I had. And just to summarize, I'm sure most of us would have heard this quote before. But we like talking about this a lot. So I like to read this. The healing professions are in the midst of a major sea change, a once-in-a-century shift. We are moving from medicine practice as individual heroism to medicine as a team sport. So I think this is extremely important. This is happening in many other areas of different businesses, different industries. I think healthcare is taking more time, but I think it's important for healthcare to understand that healthcare is also a team sport and it has to be played like a team sport. Thank you.